Armando, let's just jump right in. Auxilium, you run the company. You've been growing sales 35–40% for the past 5 years. Analysts say you can keep doing it. How do you do it for the next 18 months?
Well, you know, we've had a really good run over the past 4 or 5 years, and it's been due to one product. We now have a product that was just recently introduced called Xiaflex. It's for a condition known as Dupuytren's contracture that affects the palm of the hand and causes the fingers to contract. Our product breaks down the collagen that forms and actually breaks it down. And Xiaflex, we believe, can be a company-transforming product.
Now, when you talk about company transforming, obviously you've already had the great sales. You've proven you can do it. What kind of additional growth are we talking about?
Well, you know, we actually won't comment specifically on the exact percentage growth that we're going to have, but we believe that Xiaflex, in 2 particular indications, Dupuytren's contracture as well as Peyronie's disease, can actually become a billion-dollar product worldwide. And we think over 2
years, 5 years?
Yeah, we won't give you a specifics. Okay. We believe at peak revenue we can exceed over $1 billion and be a blockbuster.
So it's used for the contraction of the hand, or to fight contraction of the hand, but are there some other applications that might be relevant?
Yeah, the first indication is for the contraction, and it basically will hopefully replace surgery, which is the only option that they have today.
Which is a plus for insurance companies, right? Doesn't cost as much.
At the end of the day, I think that actually gives a very good benefit-risk ratio to the insurance companies, a cost-effective story, and at the end of the day, for the patient, is non-invasive. So it, in essence, allows the patient to actually get relief of their hand and the contracture, be back to work in a shorter time period than if they have to undergo surgery. There are other indications that we are looking at right now. One is for Peyronie's disease, and Peyronie's disease we hope to be able to get into phase 3 studies later on this year.
And explain Peyronie's disease?
Peyronie's disease is actually a curvature of the penis, and actually it's plaque that forms that actually causes a distinctive curvature. Again, surgery is the only option for men that suffer from this, and Xiaflex has been shown to break it down in the phase 2B studies, and hopefully we'll be into phase 3 studies later on this year.
Now, Betty, feel free to jump in here if you'd like.
Well, I wanted to just talk a bit more about Xiaflex because, you know, Armando, I know that you've partnered with Pfizer to work on this in Europe and Asia. How was that going, and is this going to lead to more partnerships with the drug maker?
Yeah, I think that we did a partnership with Pfizer back in December of 2008, and Pfizer has responsibility for the European commercialization of Xiaflex for both Dupuytren's as well as Peyronie's disease. Right now, they have already submitted the application for Dupuytren's contracture and are working through the regulatory process in order to hopefully get an approval in 2011 and then commercialize it.
Right. And,
now, Armando, the analyst.
I just wanted to follow up on that real quickly because some might say, though, that this Pfizer partnership could lead others to speculate that Pfizer may, in fact, be interested in acquiring your company at some point.
Well, it's obviously not something that we're interested at this particular point. We believe that we have a great success story with Auxilium and believe that we can run this company independently, and we're going to use them as a partner in order to hopefully commercialize Xiaflex in Europe quite effectively.
Armando, it's a pleasure to have you. Thank you, sir.